This is chapter 7, and I'll be starting with axial skeleton. Now, the axial skeleton are the skeleton that makes the axis of the body. Those are the skeleton that makes the major skeleton, the major axis of the body. So when you look at this skeleton here, the axial skeleton is the one in yellow. That is this part that makes the major axis of the body. That's the axial skeleton. Now, there are about 206 bones in her body, and 80 of it makes the axial skeleton, and 126 the appendicular skeleton. So our skeleton is divided into two, like I said in the previous video. We have the axial skeleton. From the word axial, you see the word axis there. So it means it's from the axis of the body. Then you have the appendicular skeleton, which makes the appendages of the body, right? So appendages, attachment. And that's where you have the upper limb, the lower limb, the pelvic girdle, the pectoral girdle. Those are the appendicular skeleton. So as we look at the axial skeleton, we'll be looking at the skull, the bones that form the skull. We'll look at the bones of the face, the cranium, look at the auditory ossicles, the hyoid bone, the sternum, the ribs. So you see the skull is made up of the cranium and facial bones. You have the auditory ossicles, the bones of the hair. There are 3 of them on each side. Then we have the hyoid bone, the bone that does not articulate with any other bone. That's the most special bone in your body. And that's, you have the sternum, which is the bone right here. All right. We have the sternum, we have the ribs. There are 12 ribs on each side, so that makes 24 ribs in total. We have the thoracic, the cervical, we have the lumbar, we have the thoracic, which we'll discuss at details. Let's go. All right, so looking at this, you see the skull, the bone of the skull. I'm going to look at the bone of the skull. I will briefly look at the bone of the face, then to make sure the video is not too long. Now, the bone of the skull is made up of the cranium and also the bone of the face. Now, the bone of the cranium, you have the parietal bone here. Now, you have 2 parietal bones. You have 2 of these because you have one on the right side, the lateral side, one on the left lateral side. So you have one on this side, one on this side. Those are 2 parietal bones. They are joined together at the middle, the sagittal suture, which I'll be talking about. Now we have the one here, occipital bone, which is what you are seeing here, the occipital bone. You have the frontal bone at the front here, that's frontal bone. It's connected to the parietal. You have the temporal on the side. You have the sphenoid, you have the ethmoid. So you have 2 parietal bone and you have 2 ethmoid, 2 parietal bone and 2 ethmoid bone. Others are 1 each. For the facial bone, you have maxillary bone. The maxilla is the bone right here that makes the upper jaw. Then you have the mandible, which makes the lower jaw. Then you have the palatine bones. You have the nasal bone, the bone around the nose. You have the zygomatic bone, which I'll be talking about later. You have the lacrimal. The lacrimal bone is right inside there. Then you have the vomer, which works with appendicular plates. Then the septum to divide the nostrils. You have the mandible as well. All right. So those are the major bones that are discussed. That we have that makes the skull, the cranium, and the bones of the face. And here you go. These are these bones here. You see, again, you have the frontal bone here, which makes the frontal part of the face. You have the parietal on this side, another parietal on this side. Then so you have on this side, I'm going to show you some few connections here. So on this side, you have, so here's the frontal bone. Here is a parietal. Here's another parietal. You have the sphenoid bone here. You have, this is the zygomatic bone. You have the ethmoid is right inward there. You see the ethmoid there. These are nasal bones. This is a vomer. This is the perpendicular plate I mentioned the other time. You have the supraorbital foramen here, and this we call it supraorbital margin, the ridge. For this supraorbital margin is a folding on that area, which I'll show you later. We call this supraorbital foramen, and so you're going to have inferior. Supra means it's superior, so this is inferior orbital fissure, and superior orbital fissure rather. So this is superior here, meaning that is above. This is inferior, means that is below. And here, so this is supraorbital foramen, and this here is infraorbital foramen. All right. It's simply saying this is below the orbit, this is above the orbit. So above the orbit on the superior margin, you have the supraorbital foramen. Below it, you have the infraorbital foramen. This is the orbit, right? Now, then I told you about the fissures. This is the optical canal right there. Then again, zygomatic bone, nasal bones are there. You have the maxilla here. You have the mandible here. All right. Yeah. So I think those are the major bones that you want to note on this slide. All right, so I've talked about those bones. Again, this is a lateral view of the skull. I will point to this again because it's very important. So you have the frontal bone here. You have parietal on this side, another parietal there. So there are two parietal. You have temporal here, and another temporal on the other side. That is two temporal. You have one sphenoid bone. The sphenoid bone, this is the sphenoid. This is the bone that hosts the sella turcica. The sella turcica is part of this sphenoid bone, and it is inside the sella turcica. So we call it sella turcica. I'm going to write it here. Sella turcica. It is the sella turcica that holds what we call the pituitary gland. And you know the pituitary gland is a master gland among your endocrine gland. Is a master gland that control other glands. So the hypothalamus relates with the pituitary gland relates with other glands. So it's very important, and it is located in that sella turcica of the sphenoid gland, or the sphenoid bone. So we have the sphenoid is just one. We have the temporal two. We have occipital, which is one as well. Then we have the ethmoid there. So those are the bone of the skull. Now, please look at this very closely with me. This bone is the zygomatic bone, and this bone in the temporal bone. You will see that they are connected. This connection, they form an arc. By the time I show you on the other image to make better clarity to you, there's an arc. This is an arc. Now, this arc is made by the articulation of these two bones. Now, so on the part of this bone, this is the zygomatic bone. Now, processes, like I told you in the previous chapter, means projections, right? So when you say process, it means projection. So this is a process on this zygomatic bone that connect with temporal bone. So we call it temporal process of zygomatic bone right here. So temporal process of zygomatic bone. And here is a process that continues to the zygomatic bone on the temporal bone. So we call it zygomatic process of temporal bone. All right. So these two, the processes, makes what we call zygomatic arc. All right. Now that's the zygomatic arc there. We have the styloid process here. We have the mastoid process here. You see, processes are projection. This is a projection, styloid process. This is another projection, larger projection, mastoid process. All right. Now, Another thing I want to show you before I leave this slide is at the sutures. Now, if you look at this, you will see that the the bones of the skull or the bone of the cranium, they are all connected together, right? And it appears as though it's just one bone, even though they are different bones, right? Now, so when you see the frontal bone, you see the frontal bone connecting with the parietal bones. This connection, we call it coronal suture. Now, suture simply means it's like weaving. It's like things are joined together, sutured together. All right. So the bones are sutured, and you can see that it's like weaving here. The way they are connected, it's like a weaving connection. So the frontal bone is weaved to the parietal bone at the coronal suture. The parietal bones are weaved with the temporal bone. Don't forget there are two of each of these, right? There are two parietal, there are two temporal. This connection where they are weaved together, we call it squamous suture. Now, the parietal bone are also weaved with the occipital, and we call that lambdoid suture. Now, parietal bones are two as well, right? So that means they will be weaved at the middle here. This point, we call it sagittal. We call it sagittal suture. See, sagittal suture. All right, so that's the suture that connects the two parietal bones together. Let's go. So here's the frontal bone, like I told you. On the frontal bone, I'll touch some of these, then I'll just skip some of them since I've discussed them. On the frontal bone is what forms the anterior portion of your cranium, and it's also formed part of the floor of the part of the cranial floor and also orbital cavities. The major thing you see there at the anterior side, you have the supraorbital foramen. You remember I showed you that opening the other time. The opening allow blood vessels to enter the frontal bone, the frontal area. Now on the foramen, right around the foramen, you have the margin, which I call the folding above your orbit. So we call it supraorbital margin. All right. Again, it's a thickened margin above your orbit. So that's a thickened area here. We call it supraorbital orbit. Then there are frontal sinuses, which are openings that open into the nasal cavity, and I will talk about that later. Parietal, again, they form the floor and they form the roof and lateral side of your cranium. So the roof and the lateral side, that's parietal bone. Okay, I've discussed this. I'll come back here to talk about now. If you look at this before I go, you see I couldn't see this on the other slide because it was lateral view and superior view. Now this is an inferior view of your skull. Now this is occipital bone. All right, this is occipital bone, and you see when you're looking at the occipital, here is what we call foramen magnum. Foramen magnum. This foramen magnum is what connects with the first cervical bone right behind. So the first cervical bone is right here, and this is where the spinal cord continues into the vertebral foramen of the vertebral bones. I'm still going to show you that later. All right. Again, these are frontal bone. This is maxilla. Mandible is going to be on the other side. So you see some of the bones that we've talked about. They are all right here. All right. So let's go. All right. So the temporal bone, as I showed you that the temporal bone forms the inferior, the lower part and lateral wall of the cranium. It continues the continuation of parietal, right? And there's mandibular fossa on the mandible there, and that mandibular fossa, it's a depression, and that depression articulates with mandibular condyle of the mandible to form what we call temporal. So temporal bone and mandible joint. So temporal mandibular joint. External auditory meatus is also there, and that meatus allow sound waves to reach the middle here. Mastoid process is there, is a projection as well. Like I showed you, is a bigger projection than the styloid, and that allow attachment of muscles of the neck. Then styloid process is another projection there. They are pointed bony projection for muscles and ligament. Now, zygomatic process is what I showed you. It is on the temporal bone, and that connect with the temporal process of zygomatic bone, which is what forms the zygomatic arc. On the occipital, I've shown you the foramen magnum, which is, and I told you that the foramen magnum, it's an opening inferior part of the occipital, and that's what continue. That's where the spinal cord pass to leave the cranium and go into the vertebral column, the vertebral coronum on the vertebral foramen. All right. External occipital protuberance is a bony projection for attachment of cervical ligament. I will show you that. Then we have the superior and inferior nuclear lines, which are ridges that extend from the external occipital protuberance for muscle attraction. So I'm going to show you the external occipital projection, which allows cervical ligaments to connect to it. So that's it right here. That's the protuberance here. It does it right here. You see? That's a projection protuberance right here. Right, let's go. Now the sphenoid, I told you key thing that you should never forget about the sphenoid is that it consists of cellar torcica, and the cellar torcica is what hosts the pituitary gland. You should not forget that. It has greater and lesser wing, which form the part of the floor of the cranium, orbit wall, and lateral wall of the skull. There's optic foramen that I showed you on there, which opens for optic nerve. And there's sphenoid sinuses which drain into the nasal cavity as well. Now, the appearance of the sphenoid is like a butterfly, like you see on the image we saw earlier. You see it in the middle of the skull, the front part of the cranial floor. And all right, that's that. Okay, so this is the sphenoid. You can see it has the appearance of butterfly, like you can see there, and it is right here. That's the sphenoid right here. See the sphenoid right here, and here is where the pituitary gland sits in, and it is called a cellar torcica. That's a greater wing here. That's a lesser wing here. Bone, you see the Ethmoid bone is right. The Ethmoid bone is somewhere right there around your nose area. And so the major thing that you see about it is that it forms the cranial floor location wall of orbit. You see that portion of the nasal septum. Nasal septum is what divides the nose into the nostrils into two, right? Crystal gully is projection that attach to the dura mater of the brain, and it's right on the Ethmoid bone. Key thing that I've mentioned earlier, I told you the vomer and the plate that is perpendicular to the vomer. So the vomer is like right here, and then there's another plate that is vertical, perpendicular to the vomer. Now, the perpendicular plate, that's a vertical plate that forms the nasal septum, which divides the nostrils into two. So we have the superior and inferior and middle nasal conchae, which are projections that protrude into the nasal cavity as well. Then we have the ethmoid sinuses. Again, these are part of the sinuses that drain into the nasal cavity. So that's the ethmoid bone there. That's the crystal galley, the superior nasal conchae, the perpendicular plate that connects with the vomer, right? And yeah. Okay, again, looking at this, here again is your ethmoid bone right here. That's your ethmoid bone inside, deep inside here. That's your ethmoid bone. It is what continues here. You can see this is the perpendicular plate, which is also on the ethmoid bone. This is perpendicular plate. This is the vomer. All right, you see that? And it is the perpendicular plate and the vomer that form what we call nasal septum. You see that? Nasal septum. And so that's what divides the nostrils into two. You see? So this is the right, there is the left. Okay, so that's the ethmoid bone right there. Now, the maxilla is the bone that you have right here. That's the maxilla. Here's the maxilla. See that? That's the maxilla. It's what forms the upper jaw and makes the gingiva for the upper teeth. All right. So maxilla is it's from the upper jaw. You see that originally paired bones that fused before birth form the floor of the orbit and nasal cavity, form part of the hard palate. So the hard palate is what you touch with your tongue when you touch the roof of your mouth. That is with your tongue. That is the hard palate there. And so the landmark, we have the palatine process, which is part of the hard palate in the roof. We have the maxillar sinuses, which also drain in the nasal cavity. We have the infraorbital foramen that I showed you the other time. Again, foramen are openings, so they allow for nerve and blood vessels to pass through it. We have the alveoli there, which are socket in which teeth are embedded. Now, zygomatic bone, that's what I showed you that had temporal process on it that formed the zygomatic arc with the temporal process, right? Okay, let's go. Okay, we've talked about the vomer, the mandible. Again, that's worth the mandible is worth that's what forms the lower jaw. So the lower jaw is formed by the mandible. That's the mandible there. And it forms the gingiva. That's where it forms with the gingiva, which connects the lower tooth, the lower teeth, right? So here you have the mental foramen. Again, foramen are simply opening that allow blood vessels or nerves to pass through it. This is a projection, so we call it mental protuberance. There's alveolar process that we talked about there. And these are the cranoid process. All right. Now, so that's the mandible there. Again, it has the body. It has a body, which are the main portion of the mandible. It has the rami, which are simply the arm, the sides. We have the angle, the condylar process. The major thing the condylar process does is that it connects the mandibular fossa and articular tubercle of the temporal bone together to form what we call the TMJ, temporomandibular joints. So the cranial process is for muscle attachment. The muscle, the muscle temporalis major, which you use in chewing. That is the projection that allows them. The mandibular foramen, I told you about that already. It's again for blood vessels and nerves to innervate the roof canal below the teeth. They have the mental foramen, which are opening for blood vessels and nerve as well. Alveoli are sockets where the teeth are embedded. All right, paranasal sinuses. Sinuses are openings. And the purpose of the opening first, one of it is that it helps to reduce the width of the bone of your skull. So the sinuses is that's part of what makes, you have cavities, you have sinuses in your skull, which is the reason you can carry your skull, right? Which is why it's not all too heavy. So there are cavities that are found within some of the cranial and facial bones. Majorly, they surround the nasal region and they open into the nasal cavity. All right. So we have the frontal sinus, which drains from the frontal bone, the eye area. And then we have the ethmoid, which you see around the nose. We have the sphenoid coming from the hair region there on the side. Then we have the maxilla. And so that's why we use the ear, nose, and throat for doctors that treat that ENT, right? Because the sinuses allow communication, which is sometimes what is filled up and it affects the sand. So you see, the function is to lighten the weight of the bone and also to lighten the weight of the bone and also to resonate sand. That's why you notice that when it is cold and you have your nasal cavity filled up, the sound that your voice makes differ at such points. Now, here are fontanels, and fontanels simply means, here are fontanels. Fontanels simply means the brain, the skull that is not fully ossified yet. And that is what you see in babies at the point of delivery. At the point of delivery, the skull of the uh, fetal or the skull of the fetus has not fully formed at that point. And that is why they are able to be flexible enough to pass through the birth canal for the baby to be born. If not, every child will be born with CS. But the fact that the fontanelle is still there, the baby's head is not fully ossified, fully calcified, and at that point they can be flexible, pass through the birth canal, and now take back their shape again. And if you have witnessed childbirth, you will notice that at the point where the baby's head is coming out, everything seems modeled together as though they are flexible to change shape, and so they take the shape of the birth canal at the point of delivery. All right. So there are area of developing cranium that have not been completely ossified, and it will eventually ossify to form what we call sutures that we described earlier: the coronal suture, the lambdoid suture, the squamous suture, and the sagittal suture will later form at those locations. Now, they provide flexibility for fetal head as it goes through the birth canal, and they also allow your brain to grow. So the brain has not been fully grown at the time that a fetus is born. The fontanelle allows that to happen as the baby grows, the brain. Now, we've talked about sutures, right? So I'll just continue. This hyoid bone is the most special bone in your system because it doesn't articulate with any other bone in our system. And so you see it right there, is right above the articular cartilage, right there. I mean the thyroid cartilage rather. Now, on your cervical bones, so in newborn, there are about 33 bones that makes up the cervical bones. I mean the vertebral bones, and in adults is about 26 vertebral bones. And if you look at it, we have 7 cervical, we have 7 cervical, we have 7 cervical, we have 12 thoracic, and we have um 5 lumbar, we have 1 sacrum, and then we have 1 coccyx. Now, the idea is this. Yes, there are 7 coccyx, I mean cervical, 12 thoracic, and a student told me sometimes that you eat breakfast at 7, you eat lunch at 12, you eat dinner at 5. Now, sacrum is 1 in adults, but it used to be about 4 to 5 bones in developing bone in children, in newborns. Then coccyx or coccygeal used to be about 3 to 4 bones also in newborn. So that's why. So if you add 4 to this plus 4, then you add plus 3 again, that makes it 33 bones in newborn. All right. Now, so that's what it is. Now, looking at this, you see that there are curves here. So the cervical are the bones around the neck. And the first cervical is called atlas because it is different from other cervical. And the second cervical is called axis. Second cervical is called axis. Now, look at this. You will notice that there are different curves on the cervical, on the vertebral bones. This is a convex curve on the cervical. This is a concave curve on the thoracic. And here is a convex curve again on the lumbar and a concave curve on the sacra. So there are 4 curves in total. Now, the convex curves, we call them the secondary curves. And the concave curves, we call them the primary curves. Why do they call them primary? We call them primary curves because they are curves that were developed before the before the child was born. These are primary curves. They are primary curves because they are curves that were developed before birth. Now, why are they so important? You will notice that they contain vital organs. All right. So you see the heart in this area, you see the lungs there. So this area, these organs are existing and they are fully formed at the time that a child is born. Again, you see here, you see in the sacral area, you see the reproductive organs there. So those organs, those curves are primary curves. But the secondary curves are the curves that are not fully formed yet at the point that a baby is born. And that is why you notice when you want to carry a baby, they ask you to support the neck and also the lower back. It's because the curves have not been fully formed at that point. All right, so those are curves. So again, they are primary curves, the thoracic and lumbar, and sacral. Then secondary curves are cervical and lumbar. All right, so we talked about curves already. I'll just continue. Now, here is when there are abnormal curves. All right, kyphosis is when there is exaggerated thoracic curve. All right, so you see the thoracic become quite more convex than it is. Uh, This is lordosis. Lordosis, every pregnant woman have lordosis. So you see the lumbar become more convex than it was. And here is when the is lateral bending of the thoracic curve. Now, looking at this, you see of different parts of the vertebral bones right here. Now, the first thing I want to show you here is you see the spinous process here, and this is the posterior view. This is the posterior side. This is posterior. This is anterior. Okay. Now, but this is when you are looking at the cervical, the vertebral bone from the top, so like an inferior view, right? Now, looking at this here, this is lateral view. You are looking at it on the side. So this is the posterior side. This is the anterior side. So in the anterior side, you have the body, right? Then the posterior side, you have the spinous process, which is right there on the side, on the back. Then you have on the side, you have the transverse processes, all right? You have the vertebral foramen. This is where the spinal cord is going to pass through. And here is it here. So you see, it's right there. That's where the spinal cord passed through. Okay, you have the superior articular facet, which is what is going to articulate with the ribs. All right. Okay, let's go. Now, okay, I'll just skip that. We've talked about it. Now, between each vertebral bone, there are vertebral disc. They are vertebral disc. The vertebral disc is what you see in between here. Right? So here are the vertebral disc. Here are the vertebral disc. Now, the purpose of the disc is to prevent majorly to serve as an absorber, to prevent shocks, to prevent pressure to the bone, to prevent friction between the bones. So it allows for strong joints between the vertebra. Now, these discs are made up of, there's a cartilage there, and it's called fibrocartilage. All right. Now, it allows flexibility, absorb shock. With aging, the disc becomes stiff and compressed because of pressure, and this results in decreased height over time and lots of flexibility. So, you know, back pain is usually predominant at older ages. Intervertebral foramen, that's a pair of lateral opening formed between the joint, and that is where spinal nerve will exit. That is intervertebral foramen. Okay. All right. So looking at the cervical, I told you that C1 is different and I'll just use the image here. And the key thing about C1 is the first cervical bone, and C2, we call it the second cervical bone. So looking at these bones here, these are C1 and C2. So the first one here that look like a ring is C1, and we call it atlas. Now, the second bone here that has a den, we call it axis. This is C2. Now, key thing that you see, this bone is, they make a joint here, and the name of that joint is called atlatoaxial joint. Now, don't mix it up. It's not Atlanta, okay? They make atlantoaxial joints. Now, this joint that forms between this joint that form between C1 and C2, the first cervical and the second cervical, is the joint responsible for this movement, the lateral rotation of your head. That's the joint that moves, that makes you say no. All right, that is the joint right there. All right, now you see that C1 does not have the den, obviously, and it doesn't have this vertebral body, which we call centrum. This is called centrum of vertebral body. C1 doesn't have that. C1 is just like a ring. All right, but the other cervical have this orientation. Number one thing you see on other cervical is that you see that their spinous process is splitted into two. So we call it bifid spinous process. It is only cervical that have that kind of bifid process. There is also one thing about cervical. You will notice there's an opening here. You notice another opening here on C2. You also notice another opening here. Now, this opening, we call it transverse foramen because this is transverse process. So on the transverse process, this is transverse process, then there's an opening on it, which is called transverse foramen. It is only cervical that have the transverse foramen. All right, so if you want to identify cervical, you only need to look for the transverse foramen, which is what you see here, the transverse foramen. Now, again, for C1, you have to know C1, you need to know C2, C3 to C7, they have the same features generally. So you don't need to know which one is C3, you don't need to know which one is C4, you don't need to know which one is C5. You only need to know C1 and C2 as a separate cervical bone. Now, looking at this is thoracic. Again, what you will notice on thoracic, if you look at cervical, you will notice that the centrum or the vertebral body is small. But when you come to thoracic, you will notice that it has a larger centrum. That's the first thing you want to take note that help you to differentiate thoracic. It has a larger centrum, still centrum, but a larger centrum. Why is it larger? You see, this is larger centrum. It's larger centrum because thoracic is bearing more weight than what cervical is bearing, right? Now look at the transverse process. Again, transverse process here does not have transverse foramen. And this is the spinous process here. It is not bifid spinous process. Sometimes when you see C7, C7 may not have the bifid sometimes, so you want to take note of that. But all cervical have the transverse foramen, but thoracic does not have transverse foramen. Now, if you look at it on the lateral side, you see how the centrum is aligned. You see how the spinous process points inferiorly. That's another thing about thoracic. Thoracic have pointed spinous process which point inferiorly. You see that? It's bent inferiorly. All right? That's key thing about it. So when you're looking for for thoracic, for cervical, you look for the bifid spinous process, you look for the transverse foramen. For thoracic, you look for the larger centrum, and you also look for the transverse process, for the spinous process that is pointed and bend inferiorly. All right. Now, next thing you are going to look for is the lumbar. When you're looking for the lumbar, you are looking for how their spinous process is. Now, first thing is this, they are going to have larger centrum. So you see the centrum here is larger. And this is the spelling of centrum so that you know centrum is C-E-N-T-R-U-M. N C R U M. So you always see it more as centrum. Vertebral body, yes, they mean the same thing, okay? That's it here. Vertebral body or centrum. Now, so lumbar have larger centrum, and that makes sense because when you are sitting, when you are your weight bearing comes on lumbar. So you have it explains why it has larger centrum. All right. Now, when you look at centrum on the lateral view, what do you notice with the spinous process? The spinous process is flat and it is straight, unlike thoracic that have pointed and bend inferiorly. Lumbar have a flat and straight um, spinous process. They don't have transverse foramen, uh, unlike cervical, and they don't have bifid spinous process like cervical as well. Now, this is sacrum. Here is sacrum. Here is sacrum, and here is coccyx, the coccygeal bone or coccyx. Now, the sacrum, what is key about it is you see the lateral sacral crest, the medial sacral crest, lateral, medial, lateral, and medial. So here are the lateral medial crest, and here are the median sacral crest. You see the sacral corner here, you see the sacral hiatus over there. Now, key thing that I wanted to take note, like I told you earlier, this sacrum used to be about 4 to 5 bones before in newborn, and later they grow and fuse together, and that's the sacral curve there. Then coccyx as well used to be about 3 to 4 bones that later fuse together to form one in adult. All right. Now, looking at the sternum is the bone that we call that is right here, right? That's the sternum right here. And here's the sternum. All right, here's the sternum. The sternum have 3 portions. It has the manubrum, it has the body of the sternum, and it has the sphenoid process. Right? So it has a manubrum, it has a body of the sternum, and the sphenoid process. Now, the sternum is connected to the ribs. You see, the ribs are all connected to the sternum. They are connected to the sternum. I will explain that. Now, if you look at the ribs right here is cervical, 6, 7, and here are the thoracic. Now, we have 12 thoracic bone, and we have 24 ribs, meaning that 12 ribs from each region. Now, if you look at this is the posterior view, so that tells you how the sternum, the ribs connect with each of the vertebrae. So each of the 12 ribs connect with the thoracic vertebra. That's it there. Now we have ribs. Looking at it anteriorly, you see some ribs like like rib 1, rib 2, rib 3, rib 4, rib 5, rib 6, and rib 7. You see that they are connected directly to the sternum using the costal cartilage. So we call those ribs, we call them vertebral costal ribs. It's vertebral costal ribs because they are connected to costal cartilages. All right, they are connected to costal cartilages, and they are called true ribs. Why are they called true ribs? They are called true ribs because they connect directly to the sternum through the cartilage. Now, rib 8 to 12, they are called false ribs. Now, the reason they are called false rib, now ribs 8 to 10 particularly, we call them vertebral chondral ribs. All right, 8 to 12, false ribs. 1 to 7, true ribs. But 8 to 12, 8 to 10 are called vertebral chondra. Where do we get the chondra from? We get it Oh, sorry, this is an error. Rib 1 to 7, they are called vertebrosternal. I'm sorry about that, vertebrosternal. And the idea of vertebrosternal is that they are connected to the sternum directly, right? Vertebrosternal because they are connected to the sternum directly. But rib 1 to 7, they are called vertebral. Rib 1 to 7, they are called vertebrochondral ribs. The reason they are called vertebrochondral ribs is because they are connected to the vertebra behind and to the cartilage in front. And see, this is ribs 8, 9, and 10. This is 8th. That's 8 there. That's 9. And that's 10 there. Now you will notice that all of these 8, 9, and 10, they are all connected together here to the cartilage. Even though they now gather with rib 7 again to connect with the sternum. So we say that rib 1 to 7, they are connected directly. So the key thing there, why they are true ribs, is because they are connected directly to the sternum. But rib 1, 8 to 10, they are connected indirectly to the sternum. But rib 11 to 12, they are not connected at all. You can see them here, they are floating. So you see, rib 11 is not connected to anything, rib 12 is not connected to anything. So even though they are false because they are floating. 1 to 7 connected directly to sternum. 8 to 10 connected indirectly to sternum. 11 to 12 not connected to sternum at all. So 1 to 7, they are true ribs or vertebrosternal ribs. 8 to 10, they are false rib or vertebrochondral rib. Then 11 to 12, they are floating ribs. They are also false ribs. All right, so we've talked about this. Talked about ribs. All right. Now, herniated disc are cases when, because of stress, the vertebral disc shifts. All right. This may result in rupture of the nucleus fibrosus and protrusion of the nucleus pulposus, which are the components of the vertebral disc. All right. If the nerve leading to the lower extremity are affected, then there may be neurological symptoms such as muscle weakness, numbness, or tingling. Spinal bifida is a congenital disorder. It is when the vertebral lamina refuse to unite. When the vertebral lamina refuse to unite, in such case, the tissues are not protected and it may lead to paralysis. That's what you see in newborn or in little kids, and they are not able to maintain some postures at that point. All right, I'll see you again. Expect appendicular skeleton part of chapter 7. Thank you.